Some families are coming in with young people in crisis, and they've sought community resources, they've sought counseling, and none of those have been available. So they bring them to the hospital and they sign the form and they say, help my child.
This morning, one member of the Hospital and Health System Association of Pennsylvania says many patients in need of mental health care have nowhere else to turn but emergency departments. The pandemic's toll on mental health is bringing renewed focus to the lack of treatment options. Fox 43's Rachel Yankunis reveals what's causing the crisis and why hospitals are calling on lawmakers to step in.
Statewide and beyond, a mental health crisis. Patients in need of services are filling Pennsylvania emergency rooms, and hospitals have nowhere to send them.
It is heartbreaking. Folks are staying in the emergency room because there isn't psychological help.
Waiting for days?
Days. And that is not what emergency departments are designed for.
Heather Tyler from the Hospital and Health System Association of Pennsylvania says there's a severe shortage of mental health care providers and treatment programs. Families face wait lists that seem never ending.
The waiting list could be 1,000 people long. What's happening is that as the crisis increases, services are harder to provide. Counties are increasingly stressed and can't provide community-based supports or in-home-based supports or crisis supports.
Fox 43 reveals that patients are staying in emergency departments for days, even weeks, as doctors frantically search for treatment options.
There was one young man that we heard about from another doctor where the hospital tried 400 placements. They don't give up. They made phone call after phone call after phone call until they found the right fit for this child.
With no increase in state funding in nearly a decade, doctors are watching Pennsylvania's mental health system crumble before their eyes.
We really need to do a better job as a system of creating more opportunities for individuals with behavioral health needs to receive care at a less restrictive level.
Fox 43 reveals that in February 2021, 40% of Pennsylvania adults reported symptoms of anxiety or depression. 26% were unable to get needed counseling or therapy.
I mean, what could happen if people are not getting the help that they need?
As part of the illness, people may feel like they don't want to go on living, or may do something to hurt themselves, or may be out of control with their behavior and inadvertently hurt someone else.
Hospitals now calling on lawmakers to increase state funding for county mental health programs by $28 million, with an additional $13 million to help emergency departments deal with the crisis. The investment could be life-saving.
Now is the time for policymakers to invest more in counties and provide them the funding in the mental health line to provide the programs that all Pennsylvania families need.
Fewer than half of adults living with mental illness receive treatment. That's according to data from the Hospital and Health System Association of PA. Some county mental health services have not had an increase in state funding in 17 years. For more information on treatment that is available, visit our website, fox43.com. I'm Rachel Yankunis, Fox 43 News.